I'm sitting here with Dr. Madeleine and she's talking about her approach to psychotherapy, which is called Neuroscience and Satir in the Satir. Dr. Madeleine, welcome.
Thank you.
This is a difficult topic. How does your approach work with people who have been traumatized? I realize that's a very general term, but you pick whatever kind of trauma you think would be helpful in terms of showing how neuroscience and Satir in the Satir is used.
So our understanding of trauma has changed, and it's like this trauma with a small t and a big T, and it's really in the perception of the individual as to the level of trauma, if you like. It's not about what happened, it's how the individual responds to that trauma. But when there's an acute trauma, there's this shift from being really scared and immobilized and wanting to run away or to fight. And if that doesn't happen. They can't run away, they can't fight. There's trapped. There's a sense of being trapped, and there's no one there to support them. And so they move into the what we used to call the freeze response, which is now called the immobilized response, where it's literally a collapse. There's a sort of a moment of freeze, and then there's a collapse. And so children and adults that I see are often in that collapse state, or that is moved into a depressed state in order to cope. And it's an incredibly brilliant system of survival. It's the rat in the cat's mouth syndrome, where in order to survive you shut everything down. The heartbeat shuts down, and breathing is barely noticeable, as if you were dead. So that in nature the animal, the attacker, gives up. So we have that system too. It's a very old system, and it is used in trauma when we have a traumatic experience. So clients who come to see me in the Satir I will invite them to create images of that experience. Not what happened, but what's going on in their bodies at that moment in time, in the present moment of time. And again, it looks very small, very shut down, paralyzed. So I would see skeletons, mummies, hidden, buried, coffins, gravestones. And so there is this sense of barely being alive. And so very gently, very tenderly, very delicately, I will help them to create an image of how they maybe were beforehand, before the trauma, before the accident or the incident, what that looked like. So they can sort of remember and experience themselves again like they used to feel. And but we won't move too quickly. We'll stay with those images of shutdown, of near death, and appreciate, as they look at it, appreciate how it's kept them alive, how they needed to do that, how that was essential. And so there's a huge sense of relief.
So hitherto they've been thinking about this thing that they do, this reactivity, this binding reactivity, as a bad thing. And you're saying, well, yeah, it's not that helpful for you, and it definitely was helpful for you because it kept you safe.
Yeah, that's right.
So that's the first thing.
Yeah. And sometimes out of that they will be able to elicit how other things, depending on how long that state has gone on for, but to elicit other aspects that have emerged from that.
For example?
Well, for example, it could be that they become very vigilant of others. So
like watchful.
Like watchful, yeah. So adults will have told me, have not told me about the abuse, but the impact of the abuse and how they learn to watch others. And they've become very insightful and very intuitive about, and how that's made them a better therapist or married a doctor.
So a really good observer of
Really,
others
yeah.
from this standpoint
Yes,
of being stuck.
Being withdrawn, but being
withdrawn and
able to
stuck,
watch
yeah.
others. So there's a lot of what we call special gifts that come out of this, and when they see that, when they see these special gifts, they realize that that those are protectors, that they don't need the big withdrawal images of fences or cages or caves. They don't need to be hidden in that way because they have these other parts of them that have been so useful and have been protective.
So they can look at the horror of the impact, not so much of the event, but of the impact on them.
Yeah.
And at the same time, they can look at how it's been keeping them safe.
Yeah.
And they can look at the special gifts of it,
Yeah.
of this way of coping.
Yeah.
Of
And
their
look
defense.
at how they want to be.
Well, how they were before, you mentioned.
They were, yeah.
And that's the past, and in the future,
Yes.
how they
Yes.
they would be, how they could be if they didn't feel that way.
That's right. And the key here is that I don't need to hear the story of what happened. Who did what to who.
All in images.
All done. The impact is work done.
Which brings me to the question of the. So we're talking about the trauma and the memory of the trauma. Where does it go? Because it's not in the conscious memory.
No, it's in the implicit, the unconscious memory. It's in the body. The body remembers.
So the body remembers, but the conscious mind doesn't remember.
Not always, no. There may be some little flickers of it, but it's really suppressed or in the body. The body knows. The body will react, and there are subsequent behaviours. But very often the origin of that is unknown when it's done. When these traumas are very early, pre-verbally, even in utero.
And even if it's not pre-verbal, it gets shoved down into
that's right.
a place that it's not.
It's sort of like has to be shut off because it's too much. It's
a
overwhelming.
safety thing, actually.
Absolutely.
It's kept them safe not to remember it.
Absolutely, it's protected.
And in the rest of their life, unless it's dealt with, it what?
Well, it
will trigger them.
Yeah, yes. Bonnie Badenoch talks about it awakens them, but yeah, it's sort of it comes up when there's a smell or there's a certain thing that's going on that evokes your senses.
A certain kind of cologne or
yes, will bring up a reaction that the individual might not even know where it's come from because it's been shut away.
That's dysfunctional.
It can be
Because it's not related in the present to something bad, but they feel bad and they're reacting in a negative way, withdrawing or fighting or running away. This works for PTSD.
Yeah, where you get the flashbacks and the dreams.
So the impact of the trauma is there, and they can look at all the aspects of it and decide what they want to keep. So the choices,
there's lots
they
more
now
choice.
have more choice.
More choice about how they want to be different. Yeah.
Sounds very empowering.
It's very empowering, and it's lasting. It's not something they have to remember.
So they are different.
They are different.
And they take that being different
the cellular level. Yes.
Into the future, into the world.
That's right.
Yeah.
There's always hope, and hope is very, very important for people who've experienced acute or chronic trauma.
But I think what you're saying is it's less ephemeral and more permanent. So you can have more hope in the session, and oftentimes you go to a talk therapy counseling and you feel better, but you're not necessarily being better at a cellular level.
Yes. There is some research that when we do talk therapy, when we just talk about things, that there is growth. I mean, sorry, there is healing. There is healing. There's no question that for many people that has been really important. But when you're doing this work in eliciting experiences of the past that have been stuck in the body in an unconscious way, in implicit memory, there's healing. There's profound, lasting healing. And that's coming from the neuroscience. And so it makes perfect sense to be using symbols and metaphor to access stored memories that are stored in images, because talking from the left brain is not going to access those experiences that have been stored away.
And you've talked before about the safety issue. So there's the safety of the process in terms of the therapy and the therapist and the client and that relationship, and then there's the safety of what happens in the sand tray.
Yes,
can you talk a little bit about that in
sand,
relation to trauma?
right?
Because this is, you don't want to re-traumatize.
Exactly.
Yeah.
Exactly. And
So
and the
how does
sand.
that work?
Well, you see, everything is miniature. So it's all sort of downsized. The impact is downsized, and it's literally, you can move it around and manipulate it. And
I bet it doesn't look like that sometimes to people.
no,
even though it's miniature.
No, because there are some. It's the relationship between there's a power differential between the dragon and the rabbit, for example. But everything is contained within the four sides of the sand tray, which is only a few inches deep, and there's beautiful white shining sand. And so, I think for clients that they're very scared, very, very scared that they're going to be overwhelmed, but they can control it. They can stop it at any time.
They're in charge, actually.
They're in charge of it.
So which part are you in charge of as a therapist?
I'm in charge of, number one, creating safety in that relationship. Number one, safety, safety, safety. And then I'm in charge of the process of asking questions that will move them towards integration, towards transforming the impact of
So you're in charge of the safety and the process, and they're in charge of
the choice of their figurines, where they put them, how they express the figurines. The content really is the content.
I know we're talking about trauma here, but just in a sort of, in terms of the process of neuroscience and satir in the sand tray, when might you be more directive, and what would that look like?
Yeah, I call that my bossy moment. When I see something like it's screaming out at me, and it's intuitively, I think that something could be changed. So these are my words generally. I say, I wonder if I'm going to invite you to move this figurine over to here. Just try it. You can always put it back. So they will very tentatively take it, and they go, no, I don't know. They'll move it, and it's just like, of course, fits. And that's a very intuitive piece on my part, and I don't use it all the time, but it's something, and it really does integrate it, and it may even laugh. It's like, it's almost as if it was an impossible concept that this could happen. And just by moving these two little plastic figurines, there's a shift in the body, there's more breathing, there's more ability to, less stress, and more ability to have energy flowing.
From what you were saying before, it sounds like they would, if they're laughing with you at something,
you can feel the shift.
They've moved from immobilized
into the
through mobilized into play state.
Yeah, well, or you can go straight through. You can go from one
jump through to play state.
Yeah,
so now they're playing.
Being really stuck and down regulated to being in a much more playful state, and laughing and crying with relief, but mostly smiling. The eyes change.
Talk about what happens to the face, because you see it.
Yeah,
right?
I do. Yeah, it's all part of the dorsal vagal system, which is a bit complicated, but basically it comes into the face. And so when they're in a very immobilized state, their face is very down, their eyes are down, and they're pale. And then through the session, you can see the mouth moving up, you've got eye contact, and the face is lifted, the chin is lifted, and they literally look different. They literally do not look like, I have before and after pictures, and they look completely
what
different.
What you're saying is they actually are different.
They are different. Yeah, they don't. It's not just superficial.
And you talk about that with them. You ask them how they will be different.
Yeah, I say, how are you? What's happening for you? What's changed? Your face has changed. What's changed for you, and how will you be different?
How will you be different, not how will you feel different?
Yeah. Not will you do differently, but how will you be different? And how will others know that you're different?
Ah, that's interesting. So taking themselves out of themselves and looking at themselves from outside. Ah, interesting.
Yeah.
Thank you.
You're welcome.